Here we are again, talking with Michael Crichton. Dr. Michael Crichton, officially, you did get your degree, didn't you? And then dropped out. Were your parents distraught when you went from something insecure like writing and movie writing to...
I think there was a certain sense of that, yes. Mm-hmm. But that's, parents are always...
They've gotten over that. Well, let's talk about something else that's new in therapy. I've heard of a thing called aversion therapy. It involves electricity. It sounds a little sadistic. Can you tell me what you know about that?
Well, it's a strange kind of thing, and it's also a challenge to sort of modern psychiatric principles. What in effect it says is that you can stop worrying about whether somebody's hung up on his mother and just deal with him as if he were a dog.
A dog?
And a dog, right. Pavlovian dog. And the situation is such that if, for example, the person's problem is a mistress or giving up cigarettes, giving up something is an easy way to talk about it.
Mistresses, cigarettes,
sure, whatever. And both at once is very difficult. But
yeah, that's right.
But what actually happens is that they'll put a guy down and they'll show him pictures of various things, and when they show him the object which he is to build up a negative response to, they'll shock him.
Hurt him?
Somewhat, yeah. And in a fairly short period of time, you can get him pretty upset. Every time he sees this coming.
Wait a minute. Now, they take Mr. Heston, just as example, into the room, and they lay him down, and they say, now, here's a picture of your mistress. And then...
How did we get into that? I thought this was a family show.
I'm just using you as an example. It could have been anyone. And then they give him a jolt of electricity, and then his desire is to not see her again because he associates her with pain or discomfort.
It works.
How do you know? What if the guy's very weird and his mistress is someone who gives him electric shocks? I'm sorry about that.
Clever. He's so clever.
I'm toying with an important concept here. Yeah, this book, by the way, I'm a slow reader, and I have a reputation for either having read or not having read my guest books. And I am a slow reader. If stop were a longer word, I wouldn't be allowed to drive, I have a feeling. And I'm up to, in this where Mr. O'Connor has the very high fever and they are trying to diagnose it. Medical things like that are as exciting to read as a detective
story. I'm relieved to hear you've
story.
read part of it, though. I was on a talk show a couple of weeks ago, and one of the guests, as frequently seems to be the case these days, was a writer with a book out. And the host of the show, who shall be nameless, was a lady, and she said, I haven't read your book yet, but I was leafing through it last night.
You do that. If they don't even leaf, then I guess it's an actual insult to the author. But I find the drama of the histories like this, the way you write and the way Burton Rouchet writes for The New Yorker, so fascinating. I think the best way to be in medicine would be to write about it rather than to actually be practicing.
I should do it. Well, that was my decision too. But there are a lot of other people that don't think that way.
Yeah.
The reason I think I actually began to do that was out of a sense that kind of willy-nilly I had a certain combination of abilities in terms of having, for one reason, done the 4 years, and which is not something that not everybody does, and also having done enough writing to be able to try something like this. And my purpose was really to see if I could write something that the average reader could come away with a little information from.
What effect do you
have the same experience that Mr. Boughton did, where people within the discipline took pot shots at you for deserting it? Did you? I mean, the president of the AMA didn't say, what business does he have writing?
That's,
he should be healing.
That's, a howitzer on a gnat, but
that's what?
That's a howitzer shooting at a gnat.
A howitzer shooting at a gnat. The AMA is the howitzer.
Right.
How do you get along with them in general?
Generally, I really don't.
Why?
Well, I think it's really, there's nothing wrong with the AMA as long as you recognize what it is and what it's trying to do. And as long as you also recognize that what it thinks it's doing is not what it's really doing, and what it thinks it's doing, it doesn't do very well.
I fell off at that second turn there.
I think you put it in a nutshell. Have you heard from them? Would they tend to take the attitude that you had no business being in the emergency ward as an observer the way you are in this book in 5 cases, and maybe it's better for people not to know that much about what happens in there and the mistakes that can be made?
Right. One of the classic things that most annoys me is the idea that patients ought not to know what's going on. I mean, that goes back to the business of patient is nigger, you know, this kind of keep them quiet and happy and, you know, nice childlike patience. It's, I think, no longer a justifiable kind of position to take, and it's increasingly a position that gets doctors in trouble, because patients now have to know more and more about what's going on in terms of...
Why?
Well, there's
why more than before? Why has it changed?
I think there's 2 reasons. One is that, you know, as we start to restructure healthcare in this country, a large part of the restructuring has to be in terms of what patients want. And patients are not going to be in a position to determine what they want unless they know something about what can be had. The other reason is a kind of straightforward personal one. If you're going to be put on all kinds of therapies, the one that comes immediately to mind is chronic steroid therapy, for example. You really ought to know something about what this drug is that you're taking and what it can do to you.
You're talking about birth control pills.
Well,
What did you say, chronic steroid?
Chronic steroid.
What is that exactly?
Well, it's a therapy for things like arthritis, for example.
Oh, I see. Sorry.
But it can... What are the options available to the patient in terms of that, for example, that...
Well, I'm thinking not so much in terms of what you say to your doctor, no, really, I'd rather not do that.
I'd rather have arthritis.
But in terms of knowing that if you're taking a certain kind of drug, it can do this and this and this to you, possibly the things you ought to watch out for, this and this and this. And you have to be a little attentive to it, because the therapy is more complicated now, and it's slightly dangerous, you know, can be dangerous.
Dr. Crichton, Michael Crichton, what effect would you like this book to have, taking people inside the emergency ward and seeing what
I think I'd like it to give people a certain amount of information about the way a very complicated, very good modern hospital operates, because I think the general interested reader who wants to look at this kind of subject is probably going to have an opportunity to have some impact on the way that institution changes in the next 10-odd years.
I suppose the most irritating thing would be to have a serious disease and need an operation of some kind and not be able to get when they say it'll be 2.5 weeks from now. Well, can anything be done about that? How do they know that the person doesn't pass some fatal point in that 2.5 weeks?
They don't know, and that's a big problem. So, in a hospital like the Mass General, they see so much very acute injury, automobile accidents, this kind of immediate trauma requiring immediate care, that somebody who, even if you have something as serious as cancer, you may not be able to get in for as long as 3 months.
Because so many people are coming in through the emergency.
The population has exploded, why it'll be 2.5 months before they can get in.
Yeah. You know, on a lighter note, since it's late in the night, and I was leafing through Jim Bouton's book, there's that. Someone dared me to ask you about the beaver shooting episode in the book. What is that about?
Well, I'll briefly describe beaver shooting as...
We only have a few minutes. Can you compact it?
It ranges anywhere from looking up girls' dresses over the top of the dugout to hanging from the 20th floor fire escape looking in hotel room windows.
Oh, that's what it is.
Anywhere between those extremes.
I think it was in his book and not yours that I read about that. Well?
I don't know. I knew a few interns a few years ago.
Everybody who knows an intern or someone knows some horror story, like, I knew a guy who worked in a hospital, and he said that they brought a woman in, it was a Puerto Rican woman in New York, and there were a lot of young guys there, and they were examining her, something wrong here, and they found a mass. They opened her abdomen, and somebody said, that might be the kidney, and they said, you're crazy, that's always somewhere else, and they cut it in half, and of course it was, and it was her only one. She was a freak in that sense, an anomaly. And that was that.
That's a horror
Are there
story.
a lot of the... It is to me,
Yeah.
isn't it to you?
Sure, to anybody.
Yeah.
Imagine
That's
it was
not
to the
typical,
lady,
of
too.
course, and but what can be done about that? That's just a hazard of overcrowding and...
Yeah,
What?
Well, it's like, I think going to see a doctor is a lot like riding in a taxi, you know? You can get a very good driver, and it can be a pretty uncrowded road, but nonetheless, there's always a statistical possibility that something's going to happen to you, which no one can anticipate. Now, the story that you've just described, a lot of things could have been anticipated, and that's, you know, a very easy case of malpractice. Nobody, there wouldn't be any argument about it. Doesn't do much good, of course. But I think that, you know, one of the problems that medicine now has to face is how we're going to really begin to protect patients in a systematic fashion, and to really do a better job about making sure that doctors are up to par.
Are you afraid of medicine? Would you be afraid of going into the hospital?
I have kind of an odd thing. I've been very lucky with my health. I've never been in a hospital, and never, I guess, have been sick really. And
It is like.
I guess what I'd look for, as you said, is a good doctor. I think, by and large, doctors are the victims of expanding population and the increasing difficulty of making training and hospital facilities available to enough people. I don't know that the medical profession can be indicted for the cracks that are showing in the structure any more than the highway designers can for the increasing traffic problems, or the baseball players for the deteriorating quality of the teams as the numbers of teams expand.
Or television for the fact that you have to stop for a message every so often.
Yeah.
And we will be back after this one from our local.